So I have a patient here who's been diagnosed with an ankle inversion sprain, and these are our supplies inside our ankle inversion taping kit, and I'm just going to walk through a demo on how to utilize this. So first thing you want to do, if the patient hasn't shaved or has very little hair growth on their legs, you don't need to use the Pro Wrap or the under wrap. But I'm going to show you with the under wrap as well, so that if someone does have a lot of hair on their legs, that will prevent the tape from sticking. So in this little bag here, which is inside the kit, you have what we call heel and lace pads. They're already been applied the lubrication. What this does is stops any type of tape blisters in the folds in the ankle. So one goes in the front of the ankle where the ankle bends, and then the other onto the Achilles tendon just above the heel bone. Okay, those will hold on by themselves. Pro Wrap, after some practice, it'll be able to go on easily. Start it just below the calf here, and then run it all the way down the ankle. Okay, and again, this is mainly just a barrier. Underneath the foot again, to cover up all pieces. Mainly you want to try to avoid any type of rolling, because that underneath tape can be an irritant, or has at least been shown to do that. So we try and do it nice and smooth. Then you want to grab your coach tape. Right, it's the white tape. Light plast is more of a stretchy tape. We'll use that to close it off. First thing you want to do is you want to create an anchor at the top of the ankle. Okay, you start that at approximately a 30-degree angle, and what that does allows the tape to go around naturally without wrinkling. And so you're going to apply a couple, don't drop the tape, you're going to apply a couple of those at the top of the ankle and one down at the bottom. What you can do is you will go under the skin a little bit, and that's okay, that'll stop the tape from sliding. Again, with the gauche tape, now you're going to apply 3 what we call stirrups. Okay, and you start it on the inside of the ankle, okay, at the anchor, just behind the bump here. So Ryan will show you that. It's about halfway through the bump here. Okay, it goes under the heel and rolls up to the top here. Tear the tape, and then just apply it there. You can always anchor after these to hold them in place. Okay, we're going to do 3 of those, and as we do that, Ryan will tilt his leg again. You can see that we're overlapping the stirrups about half a tape width. Okay, and this creates the proper stability and protection. We'll anchor that again. For the ligament that was damaged during the injury. The last piece of tape, Ryan will turn again, I actually overlap backwards, or towards the back of the foot. And again, all the way under, all the way over. I do a little bit of a pull on the outside of the leg, and what that does is creates a little bit more tension in the foot. Then you'll anchor that. You'll come down the ankle. Now this is what we're talking about, just closing off a bit of the ankle. Now we turn to the light plast, and this is what closes off the whole ankle. This is by far going to be the most confusing. So what you do, about halfway down, you start on the front of the leg, come around, and then you start going down the ankle till you come through the middle. Okay, you're gonna go back once more round. Now, you come under the foot, okay, up to the front, okay, around the back, down again, under the foot. Then what I will do is I'll do one under, and then I'm going to come up and do it again. And here I do a little bit of a pull to give more support on the outside of the ankle. Again, coming around the back, down the front of the foot again, closing as much of the skin as I can, underneath, and follow it up again. A little bit of a pull around the front of the ankle, and then just end at the top. Rip it off. The final part is to anchor and close with 2 more anchor strips on the top and 1 anchor at the bottom. The benefit of using the light plast is the patient still has dorsiflexion and plantar flexion. Soccer players like it because now they can still kick a ball. But what they do have is this support. So the ankle can no longer twist in again. And that's your ankle inversion tape job.